Good afternoon, everyone. I'm Becky Whittish, Chairman of the Niagara County Legislature, and we're live again on LCTV today to give you our daily Niagara County COVID-19 update. We are also currently streaming on lctv.net. We are Facebook Live on the Niagara County Facebook page and also on 90.9 FM on your radio. We've also reached out, of course, to all of our local media stations and other broadcasters to give them the opportunity to use this feed if they'd like. So we thank you for joining us, everyone. I'm joined again today by Public Health Director for Niagara County, Dan Stapleton, who's going to give us an update. But before we turn to Dan with the Niagara County numbers, Governor Cuomo was on air live about an hour ago and gave our state update. I can report that he told us that as of today in New York State, there are 66,497 individuals who have tested positive for COVID-19 and a total of 1,218 deaths as a result. Certainly we're seeing those numbers rise as expected in New York State, especially across the country. We have very high numbers. Dan, not unexpectedly, it seems that we had a much bigger increase in Niagara County over the weekend as well. We went from 28 to 38, and now we're up to 51 individuals testing positive. Is that correct?
That's correct. 21 cases, an increase of 23 cases just over the weekend. As you mentioned, not unexpected. We've been saying all along that these numbers will increase, and they have. And I think we'll see that over the coming days. So upswing in cases, not unexpected. We're saying over and over again, both of us have said, assume that it's here. It's in Niagara County. It affects anyone of any age. Right now, of our 51 cases, our youngest, we have two children, 1 year old each. They have it, as well as our oldest is 83. So it affects all ages. The key is for people who are younger thinking that they're fine just because they don't have symptoms. They can have it and they can transfer it to an older person. So that's really something that we're concerned about the most is you can spread it to your parents, your grandparents, your neighbors. So that's something we need to continue to stress, that it can affect anyone of any age, and it's everywhere in Niagara County and in New York State and across the country. So and we go back to our map, our heat map, of course, that shows us where we are with our numbers. You look at the numbers and you can see that the numbers in the higher density populations are increasing. You know, you look at Niagara Falls, you look at North Tonawanda, Wheatfield, and so on. So once again, you look at those numbers, and we've moved up towards Lakeshore, Lake Ontario, with cases that we have now. So you'll see as time goes on, we want to make sure the public understands that these are the numbers that we'll be updating on a daily basis, and it's doing exactly what we said it would do. It's moving up, and everyone's getting impacted by this. So the high density is a place of concern. The fact that we now have multiple cases in the Lakeshore community, those are the things we've said would happen. And once again, the assumption needs to be that it's everywhere, and we need to make sure we're staying home.
Right. And for those residents watching, if you want to keep an eye on that map, which will be updated daily, you can go to niagaracounty.com. Right at the top of the page, there's a COVID-19 banner with about 4 or 5 different lines and links in it, and I believe it's the last link. So right at the top of niagaracounty.com, the COVID-19 banner, you'll find the link for that heat map that you can keep an eye on daily. Dan, I want to talk a little bit about your department and your team. Certainly the 15 legislators that comprise the Niagara County Legislature are proud and willing and happy to support you in any way that we can. We did push through a resolution on Friday that allowed you to bring 3 more nurses on board and working with you now out and about in the county. But can you discuss a little bit the healthcare policy in Niagara County, the deployment of your resources, your interactions with the Board of Health versus the Niagara County Legislature?
Sure. Clearly, I work for Niagara County in the legislature. That's very true. I also work under the direction of our Niagara County Board of Health, comprised of healthcare professionals, physicians, and others. So they help me when it comes to setting policy, public health policy. The legislature, for the most part, doesn't get involved in healthcare policy, public health policy. They address making sure that I have the assets that I need, whether that's staff or funding. But when it comes to healthcare policy, I work directly with my Board of Health. And of course, my colleagues, whether it's the CDC, New York State Department of Health, and so on. So what I do with the Niagara County Board of Health, who helps they help me set priorities. We all know that resources are never where they need to be, so it requires me to make decisions and prioritize. For example, when it comes to staffing, we have staffing that this weekend we're out on both days, Saturday and Sunday, following up on these positive cases, and with having 51 cases now, that requires them to prioritize what they can and cannot do. And the one thing that they're doing is making sure they follow up on these patients. They talk to the patients, they interview them, ask them what kind of comorbidities they may have, what underlying health conditions they may have. That could be complicated by COVID-19. So we check on people who are isolated at home, and of course some of these a small amount of patients are still in the hospital. But we will see times when the public wants certain types of information that we provide, number of positives, for example, the map which shows you where those cases are. But there are other priorities that are lower. We don't have the ability to provide all the information that people want. And I understand that people want that information. But it comes to the point of me working with my Board of Health and the legislature to set priorities on what we can and cannot do. All of our people in our nursing division are 100% dealing with COVID-19. People who might not have usually dealt with that or a disease like that are now working on that. So it also requires us to refocus our resources outside of nursing, environmental health, children with special needs. Those divisions will then help the nurses with coming up with those priorities as well, and making sure we do the most essential pieces of our job as much as possible. People will get information. MAP is probably a great example of that, but there are other times when they will not be able to get all the answers they want, whether it's related to HIPAA, whether it's related to another county who may be providing information. People will see as time goes on, as recently this weekend, counties will not be able to provide all the numbers that they have and information they have because we just don't have the resources across Western New York. So we work with our State Department of Health, we work with our fellow county health departments to come up with consistent policies on what information we can provide and what information we would like to provide, but the resources just aren't there to do that. And that's a juggling point. That's a constant reorganizing and making sure we do what we need to do. And that right now we're focused on making sure the patients who have COVID-19 are visited and are followed up with us on a daily basis.
Right. Well, it also seems to me too, Dan, as you get further into this, as our numbers grow, we have more and more positives coming back, and your priorities need to shift, of course. Mm-hmm. It also seems that it's less medically necessary for people to know the exact whereabouts of all these individuals throughout their weeks past. Again, we say again and again that this is everywhere now. Really, it's not about where you might have been 2 weeks ago with someone, it's where you're going now and who's out now. Is that correct, that this information, the specifics of days and times, becomes less medically necessary or helpful?
Absolutely. We look at clinical information. There's certain clinical information that we need. I mean, our nurses were doing that this weekend. While a lot of us may be home, they are out there in these communities, within all these communities in Niagara County, getting that information, and certain information becomes irrelevant. Where the person visited a week ago, 2 days ago, or a month ago is irrelevant. People hate to hear that, but it is when we're looking at the spread of a disease like this. We know that for every positive case you get, you can have thousands of undiagnosed or untested cases. The testing, as people know, and I've been mentioning this, is limited. We're really focusing on inpatients, our top priority, first responders, and healthcare personnel. Those are the people who will be getting tested and are being tested. People who do not have symptoms will not be tested. People who might have heard or thought, geez, I was in line with someone who was coughing and had a dry cough, those people won't be tested. We really need to focus limiting resources on the top priorities. Once again, inpatients, healthcare personnel, and first responders, the people who make sure we stay safe.
Right.
And so, unfortunately, people will not be tested like they would like, and we need to tell people that unfortunately, that's the fact that we have to deal with. That's the priority setting we need to do. but we want to make sure people can get information like the map, which will help, like these types of interactions with telling people these are the numbers we have right now. But yeah, it will require us to refocus our resources and not deal with things that are irrelevant to the clinical information we're dealing with.
Okay. Another question I've been getting recently is about your partnership with Eastern Niagara Hospital. We had set up that partnership to use their Newfane site potentially for quarantine if we needed it. Have you had to utilize that building at all yet?
Fortunately, we have not. You know, the use of that facility will be when we have to quarantine someone and their living conditions are not consistent with the CDC guidelines, whether it's sharing a bathroom, whether it's sharing a bedroom. People have compromised immune systems in their home. Those people, the environment won't necessarily be conducive to making sure people are safe in their home. Thankfully, you haven't had to worry about that. I get concerned that I'll need to use that, but we do still have that agreement with Newfane and Eastern Niagara Hospital, and hopefully we won't need it, but we want to make sure we're prepared if we get the case where we do need to use that.
Of course. Well, thank you, Dan, again, to you and your whole staff. We certainly appreciate everything that you're doing for our residents. We know it's an exhausting effort at this time for all of you. So thank you again for being here and keeping us updated.
Thank you for having me.
Thank you. Okay, a few other things we discussed on Friday, the fact that the legislature was having a special meeting Friday evening, and we did have a few agenda items I can update you on at this time. One of the things that we did was pass 2 resolutions that had to do with budgetary changes for the Department of Health in relation to COVID-19 to give them some more resources that they needed to help us through this situation. We were also able to pass a 30-day moratorium on interest and penalties on your county tax bill. I've had a few questions about this, especially since towns in different cities have different collection dates for their county taxes. So here's the explanation. Basically, whatever your tax bill is at the end of March, it'll be the same at the end of April. So if you previously had penalties from previous months, those don't go away. But everything is frozen in place right now until the end of April. And at that time, of course, the legislature can reconvene, reassess that, see where the situation is at that time if we need to reevaluate. We certainly didn't want people having to choose between paying their tax bills to avoid penalties and interest or compounding those, with having to choose other things in their life that they need to take care of right now, especially when people are on reduced work schedules and out of jobs and just in a difficult situation. We wanted to give that little bit of space to help people out. Last, we had beautiful weather over the weekend. I was able to get out, get some fresh air with my family, go for some walks, and I just want to commend our residents because at least down in my neighborhood where I was out and about, I certainly saw families out enjoying walks, bike rides, taking the dog or the kids for a walk. But I didn't see big groups of people in parks. I didn't see basketball games. I didn't see, picnics with more than one family or any of those situations. So people certainly are trying to maintain that social distancing or physical distancing, if you will, when they're out and about. Even as I was walking, people were very careful to take different sides of the bike path and say hello, but not get within that 6 feet of each other. So again, I just want to thank the public for those of you who are following these policies and guidelines. That really is the most important thing right now, is to stay home, stay safe, keep your distance, and stay healthy. But again, stay emotionally connected. We've heard again and again how difficult this can be for people, whether you're dealing with it firsthand as a first responder or a healthcare worker, an essential worker who needs to be around people during the day, whether you're worried about your own health or the health of a family member. This can be very overwhelming, and we understand that. And there are people out there who can help you. Please, again, I remind you that our mental health crisis services line, which is available 24/7, free and confidential for anyone to call who needs it, is at 285-3515. Again, that's 24/7. They're there to help you if you're experiencing any stress or difficulties and just need someone to reach out to. Please do that. Again, the number is 285-3515. Thank you all for joining us. We'll continue to keep you updated as we have new information. Everyone stay home, stay safe, stay healthy.